This is a twist on endocrine therapy. We've heard a lot about SERDs, or selective estrogen receptor degraders. This is a SERCA, so a selective estrogen receptor covalent antagonist. And we presented data at ASCO 2021 for 94 patients that were treated at the 450 milligram dose. This was really a heavily pretreated patient population, and I encourage everyone to kind of look at the patient characteristics when comparing the SERDs and the SERCAs across studies, because they're not all quite created equal. 85% of these patients had seen prior CDK4/6, which, as we know, is now the standard. 72, or about 3/4 of our patients, had received prior Fulvestrant. A third of patients had seen more than 4 lines in the metastatic setting, and half of our patients had seen chemotherapy. And so what we saw with this oral therapy is a median progression of over 5 months that broke down to 17% of patients having a partial response and 43% of patients having stable disease, for a clinical benefit rate with the more conservative definition of CRs, PRs, plus stable disease of at least 6 months duration of 40%. And so I think that we're going to hear more about SERDs and SERCAs, et cetera, particularly post CDK4/6. Certainly also has the possibility for these agents to go in with CDK4/6 inhibitors. But we know for patients that are highly dependent on estrogen signaling that even post aromatase inhibitor and CDK4/6, we need other very effective drugs in this space.